for you, and then she'll take it from there. So Caitlin, come on up.
Thank you. Hello, everyone. If you didn't get a packet outside, they are towards the left, so out this door and to the left on the table, and also a set of 3 dot stickers, so we'll need that later on. So thank you all for being here tonight. The first thing I want to just cover is the purpose, so why we're here. And of course, I think at this point we probably all know what we're doing here, to talk about opioid remediation activities and the strategies that are approved under the Opioid Settlement Fund. But part of that is ensuring transparency. Each one of you should have received the handouts, and that's what those are all about, is really helping you get all of the information, as much information as possible about what we're doing and how you can access the information. Most of that information can be located on one single website. So the first handout that you have outlines the core NC website, which is NC Opioid Settlement. There's more information on that handout regarding the site map and different things that you could access right there from home. It goes into county-specific local data. You can pull up outcomes from our previous money that we've spent of the funding, as well as different information about the various strategies. The other reason that we're here is to get your input. Not only do we want your input, but we need it. Each and every one of us has been impacted in one way or the other by the opioid use and opioid epidemic. So therefore, each one of us has very different experiences and very different perspectives on how to fix that problem and how to make a difference. So we really want you to help us strategize together and come up with ways to help with this problem. So briefly, we're going to go through some data. I'm not going to bore you to death, I promise. You have more thorough documents in your handout as well that go into more specific data than I'm going to hit on. I'm just going to hit some highlights. So first, the reason that we're going through some of this is, as Maya Angelou said, you can't really know where you're going until you know where you've been. So we want to look at some of the things and some of the growth that we've had over the last few years, because there are some things that we're doing that clearly are working, whether it's me doing it, whether it's us doing it at the county level. It's everybody is impacting and making these changes. So the first one that we're going to talk about is the overdose ED visits for various medications and drugs with dependency potential. So in the year 2023, that number was 207. So the year to date now is 111. So that is a 46% decrease. That's huge in 1 year. The next one that we want to focus on is the opioid overdose ED visits. Went down from 177 to 76. So an even bigger decrease, 57%. That's huge. Sorry, I don't see anybody looking as excited about that as I was. I love that number. And it just gets better. So fentanyl positive deaths for Craven County, year to date, we were at 51, which year to date, look at the dates, and it's a little bit different because those finalized reporting has not been completed. But if you look from January to October of 2023, there were 51. And this year, we had 14. So a 72.5% decrease. I'd say, yes, definite huge reason to celebrate and try to figure out what we can continue doing to keep up this trend, because it's a trend that's moving in the right direction. So I want to go into now the settlement funds at work. So some things that we've put into place last year and the funding that we spent and what we're spending this year. So our current funded strategies. So last year, so fiscal year 23 through 24, we funded the following strategies. So collaborative strategic planning, post-overdose response team, and recovery housing. How many of you knew that we have a functional post-overdose response team in Craven County? Yay, that's a good thing. When I asked that question and talked to a lot of individuals in the county and in the community, they don't know as much information about it as I would really like for them to. So Lee Stiles is here. He's our post-overdose response coordinator. And if you haven't met Lee, please do. He's doing great work. He'll share with you the numbers and the success stories that they've had. Also, recovery housing. Hope Mission is here. Thank you so much. They've been a huge help with getting our housing programs up and going, and it's been wonderful. So thank you. So some of our outcomes that we'd like to focus on from funding those strategies last year. Recovery housing support, so 23 individuals served, 23 naloxone kits distributed. Post-overdose response team, there's some data there. I'm not going to read it to you, and you could totally read the numbers yourself. I'm not going to read all of that to you, but I do want you to have the information. In the opioid epidemic response department in and of itself, there was 89 outreach events / trainings and 400 individuals that were trained on how to properly administer naloxone, which is huge. That's just what the county's department has done. That doesn't consider what the health department has done, what other individuals have done in the community, so that's just one entity, one small part of this. Also, sorry, I almost forgot to note this. If you look at the numbers for the post-overdose response team, this was just until June, the end of June of 2024. They didn't start or become operational until January of 2024. So it makes those numbers even more impactful because they were able to accomplish those types of outcomes in such a short period of time. So current opioid remediation strategies and partners. So still collaborative strategic planning, still working on recovery housing, as we know that is a huge concern for us and a huge need, continues to be. Recovery support services, and also the post-overdose response team as well. So continuing some of the efforts that we started last year when we started using and dispersing the funds, and still continuing to build upon those and help those programs grow, because it's not going to happen overnight. It's not going to be just 1 year of funding one strategy or one provider. It's really going to be a program of growth and building upon year after year what we learned and how we can make those things progress over time and have a bigger impact. Included in your handouts, you also have a copy of the breakdown of our local spending authorization. So that will show you exactly how much funding we have agreed or had authorized from the county commissioners for us to spend on each of these strategies. So once again, you can find that information as well on the Core NC website, and it goes into full detail. So all of this information is really at your fingertips. So now the fun part. We want to hear from you. This is one of the things that we really want to get your input and show us visually so we can see where everyone is. You'll notice around the room there are 10 different posters. Each of these posters has one of the strategies that we can use or we could choose to allot money for the opioid settlement funds. That door just made a noise. I thought somebody was coming to get me. So what I would like you to do is you have 3 stickers, just 1 sticker per your top 3 strategies that you think are the most critical for Craven County. Even if it's one that we're already funding, we have not perfected what we're funding or what we're giving money to or allocating this money for. So whatever you think is most critical to Craven County, your top three. So you just want to place a dot into one of those boxes on those. You also have a handout that goes into further detail about what each of those strategies are. So please don't rush. You can use that information to help you make your decision. On the posters, there is a little bit of information as far as what each of those strategies are, and it gives it some examples of different programs and different services that each strategy kind of focuses on or could encompass. Tons of strategies overlap, so just whatever occurs to you most. If you don't have stickers, Amber is in the back of the room with more stickers, so you can feel free to get more. But take your time, cast your vote on the strategies, and then once you're finished with that, then just come back to your seat and we'll reconvene and go from there. Thank you. Have fun with this. You look so excited. And if you'll start coming back to your seat, we'll give you a few more minutes and then we'll get back into it, into all the fun stuff. So for the next section, I'm going to invite our county manager, Jack Veit, to lead this part of the discussion.
Good evening. This is going to be interactive now. We got to get this thing going. So the whole purpose of this, folks, is to tell you the story, and I tell you that's a very moving story. That 51-14 doesn't move you. That's something. That's why we're doing this, right? That's why we're all here. That's why this whole program began. And I want to thank Caitlin, Jasmine Kennedy, who's no longer with us but still in the industry, and Amber Parker for their hard work over the last year to make those things a reality. I also want to thank the commissioners for believing in this program, investing in this program, doing the right thing sometimes when it's unpopular, because at the end of the day, local government's role is to save lives. And that's what we're doing here. That's what's most meaningful. But the purpose of this meeting, other than to tell you all those things, is to get feedback from you about what we're not doing. What have we not talked about tonight? And I don't know, who has a microphone out in the audience? Somebody's got to have one. There you go. So Caitlin's going to kind of go table to table, and I just want to hear from each of you. Tell me if you love what we're doing, that's great, but tell me what we're not doing. That's what I want to hear, and I want the commissioners to hear this. We got a video in the back, so anything that's on your mind, anything we need to hear, we want to hear it tonight. So Caitlin, you just want to start with Commissioner Smith. Does she have anything to add? Okay. You don't have to unless you got...
Come back to me.
We'll come to you last. Nope.
Thank you. Good? Okay.
All right. I know John's got something. Come on, John. Give us something. What are we not doing here? What do you think we can do? What are some things we need in Craven County that are going to help us even further reduce those numbers?
Access to low-income housing more.
Good. Excellent. Low-income housing. So you think, John, you think we're meeting the need on recovery housing now? We got all the right categories. We got enough for women. We got enough homes that are doing MAT. We got enough homes for men. You think we're meeting? Microphone. There we go. I'm gonna keep him going here. We're gonna get this conversation going.
Thanks, Jack. I don't know if we'll ever have enough housing, and that's just due to the damaging nature of the disease in itself.
Right.
You can always have more housing, but without the wraparound services, the housing is it's just one aspect of an overall need that an individual has.
Right. Gotcha. Thank you.
I've got something to add to that.
Please.
So beyond just the recovery housing where people are in a program, the transition housing is something that we've found that is crucial to sustained recovery. It's easy to get into recovery. It's hard to maintain it, though.
Right.
So having that step down from it has been a key factor in the success of our clients.
Awesome. Transitional housing. Great. All right, let's go to that next, table over there. There we go. I know we're going to have some employment conversations here. I'm excited.
Just to add with the transition, what about funding for those things like those transition housing? Where is that funding, and can we depend on that funding on a continuous basis?
Right. So, well, we're here because we got $18 million, right, over 18 years to spend. So that's the key. I mean, we got the ability to make investments when that investment's needed. I think the sustainability of it, obviously, we're not done with the lawsuit, right? I mean, there's still folks out there that hadn't been held accountable. We're going to continue to hold those folks accountable, and that may take some time. I think it was, I don't know if I can remember the name of the company, we just settled with someone last month, separate from the opioid settlement. So it's always good to see those things coming in. But to answer your question, we got 18 years to figure it out.
And is there a conversation, as you're trying to figure it out, is there a conversation also, because when this hits a family, what about the children and the resources for the children in those families
Right.
when these individuals are not there? I think that's something that should really be discussed as well.
Absolutely. That's a great point. And we'll hear a little bit later from our DSS director, but there are funds that, and I think he can talk about it, the START program and other things we're working on. But it's a real crisis, right? I mean, children are the ones that are most affected. They can't help themselves. It bothers me every month. I know Jeff will probably be mad at me for saying this, but when I read his report, there's never any good news. But the worst news in his report is how many children are born addicted to drugs in this county every month. I don't know what last month was. It was 8 or 9. 8 or 9 too many, right? 6. It was 8 or 9 the month before. 12. 12 too many. All right.
And I don't know how many of you are familiar with what used to be, or well, they still exist. I just feel like there's much less of them. But Casa Works used to be a pretty prevalent resource that we would rely on for women with children, women that had young children that had recently given birth that were in substance use recovery, as well as transition. There used to be a whole lot more resources to access Casa Works programs, but even those now that are still in existence stay full. So there is that need for the family unit to be included in those houses. So thank you for that.
Good question. Good answer.
So I see two places that I don't see a lot of services being offered in, and that's family support services. And I believe if the whole family gets the support and the knowledge and the education that they need, that would help their individual recovery. And the other thing that I was told by someone that moved here was that she was grateful she moved here after her recovery, because she thought that there was a lack of Alcoholics Anonymous, how do you say it? AA programs here. And so I used the RAI resource guide manual to look up the AA classes, and they're all at one, maybe 2 centers, but most of them are located at one center in downtown New Bern. So I think that might be a gap too.
Sherry, would you mind holding up that document one more time you referenced, the resource guide from REI? Folks, I hate to use this. I know this was here from you, but
She
I don't.
was holding our handouts.
Oh, okay. Well,
she doesn't have it.
I thought you held it, but anyway, REI and Mr. Tom in the back and his team with Lizzie and Mariel did a great job putting together a resource guide for Craven County. If you've got an issue, there's an answer in that book. It's a fabulous tool. Tom, it's available online. I don't know if you've got copies here, but it's an excellent. If you hadn't checked it out, please do.
So, Jack, I think you wanted me to talk about children, and as Commissioner Hunt said, the family support services. One of the things that I voted for was the evidence-based treatment services, and I think those evidence-based treatment services go even further than the person who's suffering from an addiction, but like she says, the family unit as well, that I also get some of those services to try to help them in the recovery process too. We've talked about our agency has, applied for and was awarded by the state some funds to start trying to implement the START program, which is the sobriety treatment and recovery teams, and that's a different approach to substance abuse. Substance abuse is it's the number one factor in why we become involved with families. We've got 101 children as of the last report, and approximately 2/3 of those substance abuse is the sole contributing factor why those children come into care. And that doesn't count the ones that we've had to work with parents to place outside the homes. We don't capture those numbers in that foster care number because we don't have custody of those children. But that sobriety treatment and recovery team is something where hopefully the model is that you streamline those services very quickly, at the time of the crisis when we become involved. You use some other resources that helps our staff, family mentors / peer support. You're really trying to get that individual in those treatment services very early at that time of crisis, and which we see a lot of times is when they're really willing to accept those services then. We've seen cases where parents come into the emergency room and say, I'm ready for an inpatient treatment, and if you can't get it to them right then you miss your window of opportunity. We're trying to make sure we get there in that window of opportunity. We're working right now with our contractor, Easter Seals, to hire service coordinators, clinical supervisor, looking at peer support specialists, so the family mentor, and then we'll start our training with that group, Child and Family Futures, that oversees that program and that fidelity to the model. And hopefully, we'll start seeing the results, not immediately, but in a short amount of time, even though it seems like now, maybe in a year or two, to where we see the number of children in care reduced. We see families that we're able to reunify, we're able to keep that family unit intact. And there will be some financial incentives to the county and the administration of that programs, but I think what's invaluable is that you're not going to be able to measure what you're going to be able to do to maybe stop some of these cycle of addictions that we see in families, and start that cycle in that family to where the next generation doesn't have to go through that, hopefully. So we're excited about that. So that's just something that we looked at and tried to take a different approach in dealing with that, because we don't, the way we've done things, it's hard to get good outcomes. With the amount of treatment that we have, we think that's increasing, but it's hard to get someone re-engaged when you can't get in somewhere for 2 or 3 weeks. You need to be within about a week, hopefully a couple of days is what we're going to try to do. So,
Great, Jeff. Thank you. Good stuff. I'm excited to get that program going. We are too. Okay, who we got? Yep.
Yes, so from what I can tell, unless there's something that I'm missing, we don't have any women's facilities for recovery here in Craven County. And that's huge. That's very, very needed. I get calls all the time. And until today, I didn't really have a lot of places to refer them to. I found out today that there's one in Jacksonville. It's brand new. But we needed one here at minimum. Yep. And I know that there's a lot to dealing with women when we get to family, children, and all that, but we don't even have the basic yet that I know of. And we start at 1 and then work our way to 2. But that, for me, is one of the biggest that we lack.
Yep. That great point. You're exactly right. There's no argument there. We attempted with, things happen in this industry. We attempted with a partner. It didn't work. The partner's no longer there. We're looking for a partner. If you're interested in a women's sobriety house, we're there, I do believe there is, however, Amber, you might have to correct me on this, there's one in Havelock, just opened maybe a month or 2 ago. Don't know much about it yet, but so hopefully we can keep building on that. It's the real trend. It seems like we can do everything, but the more complicated the situation, the harder it is. And I give an example, I think, from REI is if you're pregnant, you're a woman, you're needing some type of mat services, there's almost nothing available for you. And that's sad, because that's the folks that need the most help. Thank you for your comment, though.
Yes, ICGH did open a women's house in Havelock a few months ago. However, it's a very different kind of premise and setup than what we're used to seeing in Craven County. So there are some options, or that one option, really, but definitely need more of those.
Need more.
Right.
Jackson, so you might have conversations with people that will want to get involved and not really know where to begin. So while Realize You doesn't really have the capacity and I don't have the bandwidth to start a sister program, I would certainly be willing to coach, mentor, provide everything that we've done, our entire playbook, to somebody else. So if somebody reaches out to you and says they're really interested, they don't know where to get started, I've put that offer out there maybe a half dozen times. Somebody hasn't taken me up on it, but we could manage that at this time. So, I'm happy to be there any way that we can and provide every template or any, any solution that we can provide. I might not give them my grants because I want to make sure that we're not too competitive on the grants, but we can, cross that bridge when we get there.
Understood. Great. Thank you, Garrett. Great offer. And I want to thank you guys. You're sort of the pioneer here in Craven County and venturing into this arena, and you guys have done a great job. Do you want to talk a little bit about, I don't know if our schools folks or you want to talk about the special presentation we had, I guess it was earlier this week or last week. It's a really neat partnership you guys have with them. I don't know if you want to, or schools folks.
Who? Anyone in the school? So Tony Hoffman, we just had, I'm sorry? Okay, so you can share something as well. So I don't know, we came in contact with this nationally recognized speaker who goes around, and his specialty is talking to youth about some of the elements of his story, what he's learned about the importance of connection, about having a safe adult that you can talk to, and building a good tribe around you. And he talked a lot about the ways that his mental health deteriorated and factors, but he does it in a very effective way. He connects very well with the youth. So we did it 2 years ago. We did it again this year, and we're going to plan to do it the next 2 years. So it's not it's not everything, but I think it's a great place to start. It's a huge step beyond the challenges of stigma and people being afraid to talk about certain things. If we can normalize those conversations, if we can offer, safe places and recommendations on how to bring those conversations into the schools, and I think there's a lot more that we can get from that just to get more community buy-in, help family members. I know there was a little bit of concern maybe in the beginning with, okay, who's this person that we're bringing in? What's he going to talk about? What are our kids going to take away from it? Well, now we got a little bit of feedback that I think helps support the value of doing this, and we want to try to expand on that and get as much as we can from it. But it's one small thing to do, but I think it's a very important thing to do. Just normalizing the conversation around mental health challenges and addiction is going to go a tremendous way for creating that bridge between somebody suffering and getting the help that they need.
Thank you.
One last thing. So the last time that we brought Tony in, that's the name of the speaker, 2 years ago, we had a pretty good turnout and a little bit of engagement. And this time, last week, when we did it, 2 weeks ago, when we did it, it was pretty much a packed house with the kids, and they were so engaged that we ran way over time and had to cut it short because they wouldn't stop asking questions and they wouldn't stop engaging. So it looks like it's working.
Thank you.
And that says something about consistency and continuing those programs, even if the first time or the first try isn't perfect or doesn't have the outcomes that you really want to see or hope to see. You really have to keep testing and keep working at it and try to see where you can tweak and kind of make work if you really believe in it. So thank you.
Hi, everyone. Tamara Church with Coastal Coalition for Substance Awareness and Prevention. We're a 5-county coalition that focuses on youth substance use prevention, and Carteret, Craven, Jones, Onslow, and Pamlico counties, so we're on all 5 of those counties. One of the gaps, and I think will probably be addressed with what I'm seeing on these boards, is just that early intervention piece, really thinking about the why kids are starting to use in the first place and addressing that, not only thinking about adverse childhood experiences and what may push a child to want to numb or to get out of their head or whatever the case may be, but also really focusing more on the protective factors, on those positive childhood experiences. One of the things that's listed in the early intervention is trauma-sensitive schools, and I know I've presented to the schools before. I'm very hopeful that the schools are open to something of the such. Creating a safe, supportive learning environment where kids feel welcomed, where they have adults who are actually caring about them, and they know that can go a long way with helping these kids to delay initiation, which we know to be true will reduce their likelihood that they will come dependent on alcohol and other substances. So one of the places that I see that there's a gap, and I'm hopeful that we can move forward on. Thanks for letting me share.
Thank you, Tamara. Great points. I don't know if this is appropriate or not, but I'll look at my school friends. I know Luann spent a lot of time researching curriculums, and you presented to the REI group, and I think you guys have gotten down to where you're close to identifying a product. Do you want to talk about that just briefly? You or Jennifer, I don't know who would be the best there.
So what we did is we have researched a curriculum called Too Good for Drugs.
Right.
And one of the things that we had to identify is we had to make sure that we were aligned with the North Carolina Standard Course of Study,
Right.
which it is. Our secondary director and our elementary director vetted the program because it is a K-12 program. And now we have gotten, I have met with the education coordinator with that company out of Atlanta. They will come in and train the curriculum. Is rolled out with certified health and PE teachers. So we have the list of all of our staff that would be training. Our target group would be grades 1, 3, 5, 7, and 9. And the reason we opted for that was actually recommended by another district. Mm-hmm. That is what they have done, yeah. As well as the company. That's what they recommend. When you get past 9th grade, health and PE is not required. Right. So, but it is required in the 9th grade. And so that is how we plan to roll it out. We have wrapped up in a bow, and I think, Mr. Veit, we've passed it on to you now. Yep. So, but we did spend a lot of time vetting the program and reaching out to other districts in the state that have had very positive outcomes.
Thank you, Luann. Mm-hmm. I hate to put you on the spot, but I think when it was presented, it's a really neat program. I think it was Duplin County or someone south of us that had already implemented it last year, seeing good results with it, really pleased with it. So,
and I would like to, on Tamara, I'd like to tap in on what you just said earlier.
Sure.
We have rolled out a program, a check-in program. We now have done a twofold training with all of our staff, and I'm going to link it to mental health, but I'm linking it to threat assessment and suicide assessment. And so we have done a school-wide threat assessment training, and we have identified staff members. We have 5 staff members in every school that are part of the threat assessment team. This is all related to mental health, that's threat to others. And then our school counselors are our point of contact with threat to self. And so we followed the Columbia scale with that, and when students are identified, there is a determination by classification under low, moderate, and high risk, and then that would determine what type of plans for that student. And then when the student has their reentry plan back, they are partnered with a trusted adult in the school, and so there is check-in responsibility depending on the severity of how that student classifies.
Thank you.
Mm-hmm.
I'll just add briefly, we're excited about the possibility of the curriculum. And also I just want to thank the county manager and the commissioners for funding Tony Hoffman for us for this year and for the next 2 years. I think it is a really important step, and I think as we move forward, hopefully that can be sort of one of the things that we plan for in the course of all these other things that we're doing. I do think it's amazing to be in a theater like that with 700 middle schoolers, and you could have heard a pin drop. He held their attention nonstop for an hour, and then they had a half an hour and still going of questions. And I think the takeaway for me was we've got to figure out a way going forward to make sure that guidance counselors are either in the room with them and identifying the kids with the questions so that if follow-up is needed, the questions, for instance, were things like, what if I don't have parents to model behavior, appropriate behavior with regard to substances in my home? What if I don't have a trusted adult at home? So those are the questions we're getting after an hour, and they're pretty heavy questions. Yeah. For middle schoolers. So I think that we have to figure out ways of trying to have those conversations and then have them be productive for our kids so that they do figure out ways of identifying the trusted adult that's in that school building, because we are the front line for that in the school system. So
thank you. Great comments. Awesome stuff.
Thank you. And I did want to make just one comment. I'm glad that you brought it up, Jack, with the prevention program. Yep. Early intervention as a strategy is different from school-based prevention programs. So early intervention, that strategy, if you'll look at that handout, is more about early identification of high at-risk youth and then providing intervention. So those high-risk populations of children, like trauma-informed schools, There's been some communities that have had success with youth peer supports, so training individuals within the peer groups to help other adolescents and children progress through those types of situations. So there's a variety of things that does fall under early intervention, just not that key school-based prevention program. We are working on that. As we progress through our collaborative strategic plan, that will open up the door for us to choose Exhibit B strategies, which does include that school-based prevention program. However, as Jack mentioned earlier, and I'm not going to bore you anymore with the details, but some of the opioid settlement pieces are still getting settled and still coming to fruition. So we're entertaining some different ideas as far as funding and to see what we can do to make sure that we can get a prevention program implemented in the school system that's really going to be effective and impactful and really going to help where we need it to, because we know that's a huge piece.
Thank you, Caitlin. I see the rock star of Craven County no one's met yet. That's Lee Stiles right there and his team doing a great job in post-overdose response. You saw that program Caitlin talked about, and I'm not going to steal his thunder, but they're out there doing the work. Thank you.
They are. Thank you, Lee, for all the things.
Yep.
My name is Charlene Edwards. I am the Assistant Chief of Training with the Havelock Fire Department. One gap that we have seen is that we have done such great work as a community with public access Narcan. A lot of times when overdose calls go out on the 911 side of things, our EMS units arrive and the emergency no longer exists. These people are not going to the emergency department. So yes, that is a great thing. We are so thrilled that the public access Narcan trainings and people are feeling more comfortable with deploying that medication and absolutely saving lives. The gap here is that the long-term recovery piece, they're not getting access to that. One of the ways that we try to bridge that gap is we have the syringe exchange program that we've been operating out of the fire department in the city of Havelock. In November will be 8 years. Our data was not in this beautiful PowerPoint because to date we are not funded by the settlement funds yet. We're working on that and we are collaborating. Our program's data, I'd love to share it, and while I have this microphone in my hand, year to date 2025, we're not even through Q1, we have a return rate, meaning people are bringing syringes back to me, of 89%. That is record-breaking for us. Thank you. We've done a lot of changes in the last year in particular to make things more accessible for people and more comfortable for people, a more streamlined delivery. In that, we have also, in 2024, we will surpass all of what we gave out in 2024 by the end of this month in 25. We have a lot more participation, and due to that, we are now low on supplies. We have been working on donations only for the past 7 years. So we are doing great work. We've given out 30 Narcan kits year to date 2025. Our EMS units are leaving them with patients and families and doing some on-the-spot training when it applies. And we're just really happy to do this work in the community and be part of that bridge to the gap. Certainly there's more work to do. I think Lee's port team is going to be a big part of that, with that person that doesn't need anything medically by the time we get there, but we have a resource to send them to or to get them linked up with. So great things are happening in the Havelock side of the county. Wanted to make you guys aware of that and just kind of remind you we're there.
Thank you, Charlene. I've heard such great things about your program. You know, it's interesting to hear your perspective because I've heard Lee and Deb talk about it from Carolina East about just those conversations they started to have and starting to build that relationship and how long sometimes it takes to get them to take that step, right? I mean, that's so meaningful. So thank you for what you're doing. I know Tyler's got something. There he is.
Yes, my name's Tyler Harris. I'm a volunteer here in the county. First of all, Luann, the county, that school system you were modeling was Duplin County, and I believe you met those that representative at an RAI event here in this county, a collaboration event. And so, just an example, and this is a segue for RAI, of what they meant in this county. We were a pilot, this county was a pilot program, and we've been very fortunate because of that in bringing the collaboration together for agencies that are here in the county, for nonprofits in this county, from those in Carteret County and other surrounding counties as well. So kudos to RAI. We're fortunate that they're here as well. I can't go without Commissioner Mitchell mentioned, as she told the commissioner, that about NA programs, or excuse me, AA programs, and I know that there are programs for it in First Presbyterian, Christ Episcopal, Garber Methodist, a unilateral church, and some programs over in the Riverside part of New Bern that probably have 2 or 3 programs every day, 7 days a week. So there are those more that can be discovered here to help those new individuals that come to Craven County. Yes, ma'am. Thank you for that further clarification. Just the one other thing I will mention, I certainly applaud all the things that have been said here regarding substance abuse, but one in particular that you as our county manager mentioned to begin with in your opening remarks, that some programs are less popular perhaps than others, but all contributing to life as well. And that's kind of what I think we just heard from the Havelock EMS program, the eastern part of Craven County, with their success rate as well. And I would just endorse the funding of that for the supply purposes when the county looks at its budget for how it's going to spend some of the opiate settlement funds. They're very little that are being asked for.
Thank you, Tyler.
I forgot to mention earlier, syringe exchange programs, when people interact with them in substance use disorder, the CDC has told us that they are 5 times more likely to seek treatment and then 3 times more likely to report a reduction in use up to complete recovery. So would just like to put it out there that it's more than handing out needles. It's building relationships. Every single kit comes with local resources for detox and recovery. It's a platform to communicate things that they're not receiving or maybe not willing to hear from other people in their lives. It's really a great platform despite the taboo initial thought and feeling of the program. Got a great presentation. If anybody wants to learn more about it, I'm happy to share what we've been doing and what we hope to continue to do.
Thank you.
I want to go ahead and add on to what Charlene just said with syringe exchange. I know some people look at it as enabling or encouraging use, but you know that's what it looks like on the surface. But beneath the surface is so much more. And I'm just going to share with you guys some testimonials since my time being with the post-overdose response team. And I want to thank Jack and the county commissioners here for your support of our program, because these stories I'm about to share with you is proof that the money that you're putting behind our program is worth it. One young lady that's been a part of our program for about a year, Deb was working with her before I came on board, her and her boyfriend. I was taking them clean syringes, Narcan, our whole harm reduction kits. I was taking it to them for about 4 months straight when I came on board. And I went to her house one day and to take her clean needles. She comes to my work truck and she said, "Lee, today is the day." And I said, I said, "Today is the day for what?" She said, "Today is the day that I want to change my life and get clean." Later on that night, I drove her to Dick's Crisis Intervention Center in Jacksonville to start the detox process. And that's what harm reduction does. You build that communication, that trust with the individuals, where if I hadn't have been supplying her with the harm reduction kits, she wouldn't have been able to trust me enough to come to me for help. So I just thank God for just the harm reduction piece of what we do in the PORT program, and her life was saved, and her use was reduced, and I got her into the MAT program at the Moore City Treatment Center. Another gentleman on Christmas Eve night called me up, and he told me the same thing. Had been taking him supplies for a couple months. He said, "Lee, I'm ready to go to detox." Went and picked him up, took him to Dick's Crisis Intervention Center. Got there in just the nick of time because Dick's Crisis Intervention Center closed their doors the next day, and Port Health and Easter Seals are about to take over that facility soon. So took him there, sat with him through the intake process, Jack, and just encouraged him through the process. So just told him how proud of him I was. This is an individual where opioid addiction had plagued his whole family. He lost his mother to fentanyl overdose, younger sister to fentanyl overdose. His brother is one of our clients in our harm reduction program. And I told him, I said, it's time for that curse to be broken in your family, and it starts with you. And sat with him through the process, and he went through the detox process for about 5 days. That Sunday after Christmas, I went and picked this individual up, and he said, "Lee, I want to go straight to Hope Recovery." Talked to John Sauterkeys up there, and I love what they do. Pastor Gene McClendon, John, Jamie, and everybody with Hope Mission, because they're really out here on the front lines as well. And that's why it takes for us to come together and for RAI to bring us together, and where we can network and share resources so we can help our clients in situations like this. I took this gentleman down to rehab that Sunday. He's been at Hope Recovery ever since then. Saw him about 2 weeks ago to take him some clothes that his brother sent to him. Looked like a completely different individual. On our ride to detox on Christmas Eve night, he was jerking back and forth. He was foaming from the mouth. A lot of people weren't even to roll with him to detox, but I meet people right where they're at, and I believed in him, and because of that, now he's sober and he's doing good, and he's probably about to graduate in, I want to say, about 3 or 4 months, John, from the program. So that's what the money is doing, and our valedictorians and salutatorians, I got to brag on them before I stop. They came through the ED about, I want to say it's about 4 months ago. It was way back in November, and the wife, she had an abscess in her leg because she had been shooting up in her leg. She got tired of shooting up in her arm. The husband had to be brought back. His overdose had to be brought back by Narcan. He had flatline, and I went to the emergency room where the wife was, and I talked to her about treatment. And she wanted to leave the hospital, and I told her, I said, "Look, you need to really get this abscess treated. Just let the doctor see you, because this abscess is really bad, and it can really be fatal." So she took me on my word. She decided to stay to the hospital to get an abscess treated, and she said, "Lee, she said, I'm open to treatment." And I talked to her husband. He said, "I want to do this with my wife. I'm open to treatment as well." Called my friend Forrest Jones down there to the Moore City Treatment Center. And I said, "Forrest, I got 2 clients that want to start MAT on Monday. Can you get them in?" She said, "Yeah, have them report Monday morning by 9 a.m. They went to the Moore City Treatment Center by Monday morning, by 9 o'clock that Monday morning, starting MAT. They've been clean since November the 8th. Look like two completely different people. And these are people that came in the ED foaming from the mouth, sores everywhere. They came into the Carolina East Foundation Monday and met with me, Jared, and Deb, and me and Deb were in tears because they told us if it had not been for the Port Team program, we'd probably be dead right now. And that's what makes the money all worth it. That's what makes the RAI symposium and the meetings that Mr. Tom puts on every month. That's what makes it all worth it, to help people like that and to save people like that's lives, because there's many more out there. And if I could identify any gap that we're experiencing, and that's to get the word out more, and we're trying to do that, but also the first responders need to be contacting us and letting us know when they encounter an overdose. I got a call on Saturday that it was an overdose, that it went to the ED, and I was off work, and I come in Monday, and they told me they couldn't even find the person's records, that they had no knowledge that the person had came through the ED. And I'm upset because this is a person that I want to get in contact with, because this person's life can be saved too. So Jack, if we had any gap in the port team program, I know Elena can say the same thing. It would be the first responders got to get us in contact with these individuals that are experiencing these overdoses, because at the end of the day, it's about saving these individual lives, and every life is worth it. Thank you.
Thank you, Lee. Powerful stuff.
Thank you.
Powerful stuff.
Hi, I'm very new. My name is Elena Beeks. I started with Lee about 2 weeks ago doing the first or overdose response coordinator position at Carolina East. I want to say what brought me, well, first of all, Lee and I go back because we actually went to high school together, so we know each other very well. He knows how I operate. He knows what kind of person I am, and also the same I feel about him. I came into this, number one, because with the individual up there, I had an addiction to alcohol. I'm happy to say that it's been 22 years since I had my last drink. So I'm excited, yay. I also come from a little bit of a different perspective because I lost my older sister January 5th of 2023 to an overdose, which, as we found out, ended up being a suicide. So my family's been through a lot. And every life is worth saving. If you want to put it into perspective, my sister and my brother-in-law, they make about $200,000 a year and live in a 3-story house. It affects everybody. It affects every household. It doesn't matter where you come from. It doesn't matter how much money you have. It does not matter what you look like or anything. It affects everybody. And I would have to say that I do agree with Lee. Trying to get the word out there, trying to let people know that we're here networking with everybody. I've learned so many resources just this week alone. And I missed work yesterday. Unfortunately, I wasn't feeling very well, but just in the last 2 days, I've got more resources that I never even knew existed, that I wish I knew existed when my sister was still here. So I appreciate everything that everyone is doing. And I also wanted to say, my sister's name is Luann. So when she said her name, I was like, I'm supposed to be here today. This is where I'm supposed to be.
Thank you. Wow. I promised 6:30. It's 6:33. Let's take a couple more if we got them, but we're gonna wrap pretty soon.
Yes.
I think we've got some good stuff. This is amazing. So.
The feedback is great, and by all means, don't think this is the only opportunity in
That's
which
right.
you can provide feedback. This is just opening the door and starting a discussion that can be done on a larger scale. The follow-up information that you're going to receive after this meeting, you'll have my contact information as well as the additional information that you've received today. And we welcome your feedback. There will also be a follow-up survey where you can provide any additional feedback. Maybe it occurs to you after you leave here. Maybe you really didn't think you wanted to share it in front of everybody, or you have questions, just any questions that you have. You can put that on that feedback. I'll be happy to reach back out to you. Like anything we can do to get your input and talk to you about what we can do to help, just please take advantage of it. Anybody from this table?
Determinants of health. What about the social determinants of health? Transportation, food insecurity, things like that. Is that part of the discussion? I'm a tailored care manager and work with mental health, substance use populations.
Sure. So I'm not the expert on the settlement document, okay? I'll admit that. There are experts here. There's certain things that we can do under Category A with this money particularly. And some of it does deal with housing. Some of it does deal with social determinants. Transportation, I'm glad you said it. I should have said it before. Tom and his team initially came in and we talked about what were some of the barriers, right? What are holding people back from recovery? And it was clear, Tom, in those first meetings, it was transportation. Hands down, everybody had a transportation problem in Craven County. And we put a group together through Tom's leadership and Tyler's leadership and others, and we studied that issue, and we found the answer through our local CARTS program. And that program won an innovation award last year at the North Carolina County Commissioners Conference, which there are only 5 of those given in the whole state. So very meaningful things, but we are taking those things in consideration. If you've got specific ones you want us to focus on, let us know, okay? We'll see how it fits into the puzzle of what we're able to do with this money. If it's not this money, we'll find other sources that will help address the issue. But I appreciate those are important things to talk about.
Anybody else that wants to provide some feedback? Okay, Nancy.
Hi, I'm a therapist here in New Bern, and I treat people with substance use disorder. And I was just noticing the lack of stickers on medication-assisted treatment in jail. And I wanted to put a spotlight on that, because how important that is when these people are incarcerated and taken to jail. They're detoxing while they're in jail, and all they can think about is getting out and getting high again, getting out and getting rid of their withdrawal symptoms. And I think that if we could work with the people in jail and get them treatment while they are there, they have a lot better chance when they leave to continue. We've got to get them stable. We're just letting them go back out and continue what they're doing, and it's not working.
Right. Great comment. So there's a really interesting program. I believe it's in Carteret County. I think Sheriff Buck is working with Vivitrol, which is I'm not a doctor either, so I can't tell you all the things. What I know is it helps alleviate the craving and helps deal with that addiction. I think there's been some great success with it. I know Sheriff Hughes is working with Sheriff Buck on learning about the program. Obviously, Sheriff Hughes, he has to run the jail and things that he's willing to do, but there's certainly conversations happening around that, okay? Thank you. All right, 6:39. Thank you all for being here. Caitlin, anything else from you? I'm going to wrap it if not. We appreciate you being here, but more importantly, we appreciate you doing the things that help us deal with the statistics that we dealt with and talked about earlier. If it wasn't for you, those numbers wouldn't look like that. Every one of you. It's a monumental task, but obviously we're all here because we're willing to take that on. If there's things, as Caitlin said, that you want to share, please contact us. This isn't the only time we're going to listen. We're going to listen every day to try to figure out things we need to do. Thank you for being here. Have safe travels home.